Hey everyone, and welcome to another Deep Dive. Today, we're all about those oh no moments, medical emergencies. We're going to be looking at a nurse assistant training module from a California community college, and we're going to be pulling out those gotta know it tips that everyone can use.
Yeah, think of it as like a crash course, but hopefully without the actual crashing part.
Right, exactly. We're not trying to turn you into paramedics or anything, but even just a little knowledge can, well, it can make a huge difference in those moments when every second counts. And this module, it starts with a whole bunch of medical terms. Some of them I'm sure you've heard before, like cardiac arrest, which, by the way, is a leading cause of death in the U.S. Pretty scary stuff.
Yeah, it really emphasizes why it's so important to understand these terms, right? Because when you're in a stressful situation, being able to communicate clearly can literally mean the difference between life and death.
Okay, so cardiac arrest, that's when the heart basically stops, right? No beat, no pulse, no blood flowing. Got it. But then there's this word, syncope, which sounds like something out of Shakespeare or something.
It does sound kind of dramatic, but really it just means fainting. You know, sudden drop in blood pressure, feeling lightheaded, maybe you even pass out, hit the floor. That's syncope.
So less Romeo and Juliet, more like, whoops, skip breakfast kind of situation.
Sometimes, yeah, that's all it is. But it can also be a sign of something more serious going on, so it's always a good idea to get it checked out just in case. And then there's hemorrhage, and we're not talking about little paper cuts here.
Oh yeah, I'm imagining more like a busted fire hydrant, water spraying everywhere except it's blood inside the body.
That's a pretty vivid image, but yeah, that's the gist of it. Hemorrhage means severe bleeding, whether it's internal or external. And if it's not controlled quickly, it can be really dangerous, even life-threatening.
Okay, enough of the blood and guts stuff. Let's move on to something a little less, I don't know, scary. I'm sure we've all had those moments where we go too long without eating, get all shaky and lightheaded. That's basically what hypoglycemia feels like, right?
Exactly. Hypoglycemia just means low blood sugar, and it's something we see a lot, especially in people with diabetes. The good news is it's usually pretty easy to treat, just need a little sugar boost.
Huh. So a sugary snack can actually be a lifesaver. You learn something new every day.
Yeah.
All right, let's dive into some of those more serious emergencies, the kind that can escalate super fast. We're talking heart attacks, strokes, seizures, things like that. Recognizing the early signs can make a huge difference in how things turn out.
For sure. And the thing is, those signs aren't always as dramatic as what you see in movies. You might think of a heart attack as that classic clutching the chest scenario, but some people experience more subtle symptoms, like pain that radiates down the arm or jaw or even back pain. Some folks even mistake it for heartburn.
Wait, seriously? So indigestion could actually be a heart attack in disguise. That's terrifying. What about strokes? I've heard there's an easy way to remember the warning signs, something about fast.
You got it. FAST. It stands for face drooping, arm weakness, speech difficulty, and T for time to call 911. It's a great tool for remembering the key signs of a stroke. Super simple, but super effective.
And with strokes, time really is of the essence, right? I remember reading this story about a woman who had a sudden, really bad headache, but just brushed it off, thinking it was nothing serious. It turned out to be a stroke. And because she waited so long to get help, the damage was way worse than it could have been.
That's why it's so important to always err on the side of caution. If you're ever unsure, just call for help. Better safe than sorry, right?
Yeah.
And this module, it talks a lot about those crucial moments before the paramedics get there, those immediate interventions that can make a world of difference.
Right, because we're not teaching anyone to be a paramedic here. But there are things you can do, even simple things that can help buy some precious time.
Exactly. The module really stresses the importance of staying calm, calling for help immediately, reassuring the person who's in distress, just making them feel safe and supported. And also knowing where to find emergency equipment, like those AEDs you see everywhere these days.
The AEDs, right, those automated external defibrillators. I gotta admit, I've seen them around, but I wouldn't have a clue how to use one.
That's where proper training comes in. But even just knowing that using a defibrillator early on can dramatically increase someone's chances of surviving a cardiac arrest, that's a powerful piece of knowledge in itself.
It really is. Speaking of life-saving interventions, I noticed something kind of interesting about CPR in this module. Apparently, they've changed the sequence from ABC, airway, breathing, circulation, to CAB, compressions, airway, breathing. Why the switch up?
It's actually super interesting. Research has shown that starting with chest compressions is more effective at getting that oxygen-rich blood flowing to the brain and vital organs.
So it's all about getting that blood pumping ASAP. Makes sense.
Exactly. It's a small change, but it makes a big difference in how we respond to cardiac emergencies.
Okay, this deep dive is already blowing my mind. But before we move on to some of the more hands-on stuff, we got to talk about something that's practically a movie cliche, the Heimlich maneuver. I've seen it done a million times on screen, but I have a feeling Hollywood doesn't always get it right.
You're probably right to be skeptical. Those movie scenes might be entertaining, but they often oversimplify or even completely misrepresent how to actually do this life-saving technique.
So it's more than just giving someone a squeeze.
Oh, definitely. The module breaks down the correct technique for abdominal thrusts, which is the core of the Heimlich maneuver. It's about applying firm upward thrusts to the abdomen, just below the rib cage. The goal is to create enough pressure to force that obstruction out of the airway.
Sounds like you need to have some upper body strength for that.
You do need a bit of force, which is why proper training is so important. Practicing on a mannequin is the best way to get the technique down and make sure you're applying the right amount of pressure.
I read this story about a teenager who used the Heimlich maneuver to save his friend from choking. It's amazing how just knowing the right technique can turn anyone into a hero.
It just shows you the power of being prepared. You never know when you might need to use these skills.
Speaking of being prepared, let's decode some of that hospital lingo. Have you ever wondered what those emergency codes they announce over the PA system actually mean? It's like a secret language, isn't it?
It is, kind of, but each code has a very specific purpose. It's all about making sure the hospital staff can respond quickly and efficiently to different situations.
All right, pop quiz. What does code red mean?
Code red means fire. It triggers a whole series of actions to keep everyone in the building safe, patients, staff, visitors, everyone.
Makes sense. What about code blue? I feel like I always hear that one in medical dramas.
Code blue usually signals a cardiac or a respiratory arrest, which means someone's in immediate danger and needs CPR. A rapid response team will rush to the scene with all the equipment and expertise they need to try and save that person's life.
Wow, that's intense. Definitely not something you want to hear in real life. What about code yellow? Does that mean like a hazardous materials situation?
Not quite, but it does indicate a potential threat. Code yellow often means there's a bomb threat or some other kind of security risk. It means they need to activate specific safety protocols.
So if you hear code yellow, stay put and follow instructions.
Exactly. Hospital code systems might vary a little from place to place, but the main idea is the same. It's about making sure there's a rapid, coordinated response to any critical situation.
So there you have it. You can now impress your friends with your insider knowledge of hospital lingo. But keep in mind, this is just the tip of the iceberg. Stay tuned for part 2, where we'll go even deeper into some specific skills and interventions that can help you take charge when an emergency strikes.
All right, welcome back to our deep dive into emergency procedures. Hope you guys are ready for more because we're going to get